I think it's very hard to feel compassion for another person if you're at the same time holding on to anger. Like, I would not want to be defined by one of my mistakes. I don't have to define them by one of their mistakes. In order to really feel compassion for them, you have to be able to let go of that.
This season, Ripples, Physician Wellbeing, will focus on the theme of facets of compassion. Compassion for self, others, and society. The Long School of Medicine Office for Graduate Medical Education utilizes a compassion course to combat feelings of imposter syndrome, guilt, or shame with challenging patient outcomes, as well as teaching mindset adjustments to promote higher self-kindness. For each facet of compassion, we'll provide you with an episode about recognizing when an instance can require grace and the pebble to activate it. We're happy you're with us. Let's create some ripples. It is my great joy and pleasure to introduce our guest today, Dr. Holly Day. Dr. Day is an assistant professor in the Department of Internal Medicine and in the Division of Hospitalists, so she and I are both hospitalists for different age groups. I met Holly actually through the Healer's Art program, which works with medical students and helping them understand the reasons why they went into medicine to begin with.
How beautiful.
And the moment I heard a lot of what she did in Healer's Art, I said, I absolutely have to have her work with me on the compassion course. And,
Yes.
and I always like to say that Holly, being a co-director, is also kind of the heart and soul of the compassion course. So
She is.
welcome, Holly.
Thank you, John, and I'm just so glad to be along for the ride.
Well,
It's
good.
wonderful.
Thank you.
Thank you.
It really is a pleasure to have you here in our podcast, but also to have you here.
Thank you.
It feels good to know that there are people out there doing the amazing things you do and feeling the way you do. And
Thank you.
of course, you talked during the compassion course about compassion for others. We've been over the past episodes talking about compassion for self.
Mm-hmm.
And as we start shifting into this idea of compassion for others, I wanted to ask you, what is this idea of common humanity, and why is that such an important foundation for what we're going to discuss?
So I think it's really the key prerequisite for having compassion for others. This idea of common humanity is accepting the principle that, you know, we're all made up of the same stuff, really.
Mm-hmm.
We all have experiences, we experience the same emotions in this life.
Yeah.
Joy, fear, pain, love, longing, hope.
Yes.
And we all have the same basic needs, the need to be safe, to be secure, to love and to be loved, to find meaning in our lives.
Wow.
And so accepting common humanity means accepting that principle that we're all made up of the same stuff deep down inside, and that your desire to have your needs met is as valid and important as my desire to have my needs met.
It really, I think it really helps that it kind of lowers the barriers
Yeah.
between us and them, so
Yeah.
that it's not us and them,
Because
it's
sometimes
all of
we just
us
see the
together.
differences.
Yeah,
Mhm.
We forget that there's so much commonality.
yes,
Mhm.
absolutely.
Yeah.
Beautiful.
So then to follow on that, so it seems only natural then that we would, having pulled those barriers down and seen ourselves more in through the eyes of other people, that we would want to look at kind of growing our forgiveness for others, for individuals, for other groups. Can you talk a little bit about how forgiveness becomes such an important next step as we start talking about compassion for others?
So we can start off by kind of discussing what forgiveness is, or clarifying that, because it can be kind of complicated. Forgiveness is letting go, intentionally letting go of the negative feelings that you might have towards another person or group for some way that they have harmed you. It doesn't have to mean that you condone what they did, and it doesn't have to mean that you accept them back into your life with no conditions attached, no boundaries. It just means that you no longer are carrying that sort of gut-twisting anger or that reaction of, ugh, when you see or think about that person.
Yeah.
You've released them from that negative emotion. I think it's very hard to feel compassion for another person if you're at the same time holding on to anger
Yes.
against them. You can recognize that, maybe what they did was wrong, or maybe what they did was harmful, but they are also human. They are also not, like, I would not want to be defined by one of my mistakes. I don't have to define them by one of their mistakes. And that, in order to really feel compassion for them, you have to be able to recognize that and let go of that.
I think that's really a powerful way to look at that. I often remember the idea of holding on to that frustration or anger for someone else. It's almost as if you're drinking poison, hoping to harm someone else, when in reality all you do is harm yourself.
Yeah.
Mm-hmm.
But it's hard to do. It's
It
hard to
is.
do, but I think recognizing that that's part of the process, it's so important. It's how we start. This is very, very deep, what we're talking about here today. And I also heard that in your process of teaching your module in the compassion course, you talk about the Nikan exercise and how it helps us feel more gratitude and experience others in ways that we haven't before, because maybe we've taken for granted some things. Can you explain to us the Nikan exercise? I'm brand new with this one.
Yeah.
I did not know it.
It's a really, it's always a popular exercise with the residents in this course. And I like it in relation to the concept of forgiveness, because they're really kind of your two pathways to improving, preserving, deepening a relationship. These are two, forgiveness and gratitude are both about how you maintain and improve your relationships with others and make them more compassionate. So if someone has harmed you, you have the ability to forgive them. But when someone has done something good for you, you have the opportunity to express gratitude. So Nikan is, in Japanese, it means looking inside or introspection. And it's a reflective exercise where you set some time aside to sit down and think about a person you have a relationship with in your life. Often it's someone that you have a close relationship with, like your parent or loved one. And then you ask yourself 3 questions. What has this person done for me or given to me? What have I given to them in return? And what troubles or challenges have I caused them? And you could set however much time, 10 minutes, 15 minutes, 30 minutes, an hour, and try to answer those questions in as much detail as you can. And it's really incredible when you finish and you look at all the amazing facets of your relationship with this person. There's often, when you stop to think about it, so many things that someone has done for you that you probably didn't even, take time to appreciate at the moment. But, like, my mom took me to every single one of my Kung Fu practices in high school, even though traffic was terrible in Austin, kind of thing.
As you're talking, I'm already, thinking automatically and imagining and thinking about my parents. And when you said, the things that we have put them through, I was like, I'm sorry, parents, I love you.
Yeah.
I tried.
It's a great thing to do for Father's Day or Mother's Day.
True.
That's
and how
neat.
beautiful, yeah.
Yeah, when I've done this, I realized pretty quickly some people actually make lists. So you make a list of all of these things. And it's interesting that you find that the list of what someone may have done for you is far longer than what you've done for them in a sense. And so sometimes you begin to see that a lot of that love and compassion is almost one directional in a sense. But that's good, because then you can say, well, I need to help equal those lists a bit.
Yes.
And that's, again, a great idea for a Mother's Day or Father's Day is to say, let me tell you what you've meant for me in my life, even though I may have never told you.
And how beautiful also that you're talking about this idea of the compassion, forgiveness, gratitude as a way to strengthen relationships with others, because we are social beings. We need those relationships with others. So I think sometimes we talk, and I see it often with our residents and fellows, and we think that we need to survive in this world alone, and that is a skill that we should develop, and I don't need anybody, and I don't want to be codependent. And yes, codependency is one thing, but interconnectedness and interdependency is a completely different idea, and we need each other. We are connected. So anything that we can practice that would allow us to feel more connected or improve those relationships, I think is worth bringing to this table.
Yeah, absolutely. And in that sense, both of these practices, even though they're gifts we give others, they're also gifts we give ourselves because of that.
So Holly, I know you have a really powerful story that really works together in a beautiful way, both the concepts of forgiveness and gratitude in what is a really challenging situation. So can you share that story with us?
Oh, yes, thank you. I'd be happy to. So this story comes from my personal experience at the beginning of COVID in 2020. And this is with a patient, the first patient that I had who was dying under COVID isolation precautions. And back in those days, we didn't have, it was very early, so we didn't have testing results to tell us right away if someone had COVID or not. So some people were spending a long time in isolation. And this, poor woman was steadily worsening, and her loved ones, her family, her husband and sons had been every day out in the waiting room asking how she's doing. And I had been, personally horrified by the fact that I was walking out to these people each day and telling them, this is how she's doing. She's struggling more to breathe. She's having trouble with anxiety. She's afraid. And no, you can't go be with her right now. Yeah. It was the most awful thing that I could ever imagine, and I never thought I would be doing that in my life to someone. And so the day came when she really had become critical, and we had gotten permission from hospital leadership to finally bring her husband and sons in the room with her to have this discussion about whether or not she wanted to be intubated or whether she wanted to go on comfort care.
And intubated meaning having a tube put in her lungs and being put on a ventilator to support her respiration.
And so this was extremely emotional. I left them in the room together by themselves to talk about it. I was sitting outside the room on a computer crying, putting in orders. And when her husband called me to tell me that she had decided not to be put on a ventilator, that she wanted to go comfort care and just be made comfortable, in a kind of fit of emotion, I told him that if he wanted to take his mask off to kiss her goodbye, I wasn't going to stop him. And I think that everyone who was directly caring for her, the nursing staff and the RT, I think we all felt at that moment that that was the human thing to do. But word kind of quickly traveled up the chain, and in a matter of like 15 minutes, I had an administrative member of the hospital executive leadership, marching down the hallway towards me, and she was quite upset with me for fair reason. She sort of started angrily berating me for assuming a power I didn't have, for breaking rules that had been put in place to protect our community. And, everyone was stressed. Fuses were short at that time. Mine included. I had been on that team, I think, for working for 10 or 11 days straight, having 2 a.m. conversations with the ICU because nobody knew anything. So when do we consult you all to take care of these patients? What's their oxygen requirement, kind of thing? And so I was in an unusually confrontational mode. I could feel myself having that autonomic response of fight or flight, and my hair was standing up and my muscles were tensed. And I told her that if she wanted him to put his mask back on, she was going to have to be the one to go in there and say that to him, because I had already robbed this family of her final days that they should have spent together. And so my boss, who's a very diplomatic and compassionate person, showed up at about the right time to start mediating this confrontation. And he could kind of see things from both sides. When I told him what I'd done, he said, yes, if that was my wife, I would want to do the same thing. But he could also foresee the possible negative consequences of my action, risking the health of this family and risking the privilege of future patients to have their family with them at end of life, because maybe I had just proven that nobody could be trusted in this sort of situation.
Sure.
We better just keep the family out. So eventually everyone calmed down, and she had taken my challenge, I think, a little personally. And so she did agree to go in and be the person to tell them about that they needed to put their masks back on. And that was a moment that I was able to take a step back and recognize and appreciate and respect her integrity for that, and also her courage to some degree, because many people were very afraid to go in those rooms. And so I offered to show her how to get in and put all the precautions on and take her in there. And when she got in there, I think it was a very humanizing moment for her too, because she could immediately see that this was just a family of normal people going through the most tragic experience that any of us ever go through in our lives, the loss of someone so dear to you. And so I could see that she genuinely felt pain for them. And she told them, I'm so sorry for what you're going through. I can only imagine how hard this is. But for everyone's safety, we have to ask you to please put your masks back on. And they did. And I helped her get out of the room, kind of following all the isolation rituals. And when she got out, she was quiet and then just thanked me and the nursing staff for taking care of this family. And so, I think that had been a moment of us all being able to calm down and to recognize and appreciate each other and each other's humanity. And a few days later, when I had calmed down more, I sent her an email apologizing, not exactly for what I did, but for putting her in the difficult position of having to be the enforcer for rules that had been created for good reasons. And she wasn't a very sentimental person, but she kind of replied to me saying that there were no hard feelings, and again, thanking me for what I was doing to take care of patients. And so it was a really, for me, important experience in forgiveness, because it would have been easy for both of us to walk out of there feeling resentful and kind of demonizing the other and each other in our own minds. But instead, we kind of forged this link of a shared experience, and I was grateful for it, because that was just the beginning of the pandemic. And over the next 2 years, as I continued to watch patients suffer and die in isolation, she was actually a very important ally for me. Anytime that I had someone who was dying, she was someone in leadership that I could reliably call and get permission to bring their family into the room to see them in their final hours, so that they didn't have to die alone. And it was just so meaningful. I was grateful for that every single time.
Wow, what a story.
So.
Yeah, I when you think back to that time, in the fear that was happening, the unknown, the very concern that literally as physicians and nurses, we may be putting our own lives at risk to take care of these, so obviously an extremely volatile, stressful environment. And so that even makes this all the more amazing a story, is that through this environment and this stress, that ultimately forgiveness, gratitude, understanding, common humanity, all came together for the best possible outcome.
Yes.
In a otherwise tragic situation.
Yeah. And sometimes crises do that. They can bring the worst out of you or the best. And I think recognizing that common humanity was something that came out of such a difficult situation, those 2 years that we were all suffering one way or the other, but we recognized that we were all in it. So
together,
yeah.
Thank you for sharing that story. It is powerful.
Thank you all.
You being the kind of person that can actually sit there, calm down, and send an email to apologize. That takes a lot.
Yeah, it's important. I think, we think about forgiveness, and it's so hard to practice towards others sometimes, but it's important to recognize and appreciate the times that you've been forgiven yourself, because we all have,
Yes.
and those are gifts.
Now,
Yeah.
with this, of course, I'm looking forward to asking you. Every episode, we ask our guests to leave with us a pebble. And we call it a pebble because we think of that idea that if you throw it in the water, it will create ripples that will expand among everybody. So is there any action, any practice, any skill that you want to leave with us? Throw it in the water, and hopefully it will create ripples of wellness.
I'm very happy to share this pebble with you all. My pebble would be the recommendation to find a way to build gratitude into your daily routine. And the way I do this is, when I come home from work at the end of each day, I make a point of telling my husband about the things that happened that day that I was grateful for, things that were good, or interactions I had with patients that were meaningful. Or sometimes, I'm going through a really hard situation with a patient, and it makes me reflect and be grateful for the good things I have in my life. This patient who is losing their mother, I'm so grateful that I have my mother still. Yeah. And this was a conscious change that we made in our routine a few years ago, because I used to do what a lot of us do,
Yes.
which is come home
Guilty.
and vent to him about everything that had been frustrating in my
Yes.
day. And then I realized at one point he asked me, like, do you even like your job?
Wow.
And I realized that I was giving him this impression that, I stayed really late all the time working this job that was just stressing me out and making me frustrated, that I didn't even like. And I realized how terrible and not the impression I wanted to give him at all, because yes, I stay late and work hard, but it's because I find this job really meaningful and rewarding. And it was much better for him too after I made that shift of no, I'm going to tell you all the good things in my day. Then he started feeling happier for me and resenting my job a little less, because he knew yes, my wife is working late again, but at least it's because it's something that she enjoys and is important to her.
Yes, and to many people, you touch many people's lives. So I'm going to say my practice of gratitude today, I'm going to include you. I will tell my husband tonight that I'm very grateful that I got to hear this story, that I got to hear this pebble, and I'm going to put it into practice. Thank you so much for being here with us.
Oh, thank you. I'm very happy to be here.
It's been great, Holly. Thank you so much.
Ripples Physicians Wellbeing is made possible by the Jon R. and Teresa Lozano Long School of Medicine Office for Graduate Medical Education. To contact us or learn more about the Wellness Home, visit gmewellness.utesca.edu.
This podcast is inspired by the Dalai Lama's powerful quote: "Just as ripples spread out when a single pebble is dropped into water, the actions of individuals can have far-reaching effects." We provide physicians with pebbles, tangible and actionable practices that can help make positive impacts in their personal and professional lives.